Which of the following is the largest artery in the human body? Option A, pulmonary artery. Option B, aorta. Option C, carotid artery. Option D, femoral artery. So B is the right answer. What is the primary function of the alveoli in the lungs? A, filtering inhaled air. Option B, warming and humidifying air. Option C, gas exchange, oxygen and carbon dioxide. Option D, producing mucus. So C is correct. The pituitary gland is also known as the option A, master gland. Option B, adrenal gland. Option C, thyroid. And option D, pancreas. So A is correct, master gland. Which vitamin is essential for blood clotting? Option A, vitamin A. Option B, vitamin C. Option C, vitamin K. And option D, vitamin D. So the C is correct, vitamin K. What is the main function of the cerebrum? Option A, regulating body temperature. Option B, coordinating voluntary movements. Option C, processing complex thought, memory, and language. Option D, controlling balance and the posture. So the C is correct. Which of the following is a symptom of hypoglycemia? Option A, high blood sugar. Option B, shivering, sweating, and confusion. Option C, sudden weight gain. Option D, decreased heart rate. So the B is correct. 7. What is the term for a protein that is produced by the immune system to neutralize pathogens? Option A, hormone. Option B, enzyme. Option C, antibody. Option D, neurotransmitter. So the C is correct. Which of the following is a common symptom of a urinary tract infection? UTI. Option A, unexplained weight loss. Option B, pain or burning during urination. Option C, sudden drop in body temperature. Option D, a severe headache. So B is correct. What is the primary function of the kidneys? Option A, pumping blood to the heart. Option B, filtering waste from the blood and producing urine. Option C, digesting food. Option D, producing hormones. So B is correct. The psychological concept of operant conditioning was proposed by option A, Sigmund Freud. Option B, Ivan Pavlov. Option C, B.F. Skinner. Option D, Carl Jung. So the C, B.F. Skinner is correct. What is the term for the study of distribution and determinants of health related states or events in specified population? Option A, pharmacology. Option B, epidemiology. Option C, toxicology. Option D, microbiology. So the B is correct. Which of the following is a key symptom of a myocardial infarction? Option A, mild headache. Option B, sudden severe chest pain. Option C, swelling in the feet. Option D, unexplained weight gain. So the B is correct. What is the main purpose of the esophagus? Option A, digesting food. Option B, pumping food to the stomach. Option C, carrying food from the pharynx to the stomach. Option D, absorbing nutrients. So the C is correct. What is the basal metabolic rate BMR? Option A, the number of calories burned during exercise. Option B, the rate at which the body uses energy while at rest. Option C, the rate at which the body digests food. Option D, the rate at which the body produces hormones. So the B is correct. 15. What is the primary cause of scurvy? Option A, vitamin A deficiency. Option B, vitamin C deficiency. Option C, vitamin D deficiency. And option D, vitamin E deficiency. So scurvy, so vitamin C is the right answer. 16. In sociology, what does the term socialization refer to? Option A, the process of moving from one social class to another. Option B, The process of learning to behave in a way that is acceptable to society. Option C, the study of social norms, and the D, the process of social change. So the B is the right answer. Which of the following is a key sign of a patient with hypertension? Option A, low blood pressure. Option B, a sudden drop in body temperature. Option C, high blood pressure. And option D, unexplained weight loss. So the C is correct answer. What is the primary cause of osteoporosis? A, lack of exercise. B, high calcium intake. C, low bone density. And the D, vitamin A deficiency. So the C, low bone density, is the right answer. 19. Which of the following is an example of a hereditary disease? Option A, common cold. Option B, Down syndrome. Option C, the flu. Option D, the asthma. So the B is the correct. The Kubler-Ross model describes the 5 stages of grief. Which of the following is one of those stages? Happiness, acceptance, excitement, or joy? So the B, acceptance, is correct. Part B, nursing subjects. What is the primary goal of the nursing intervention fluid balance chart? A, to monitor a patient's diet. 2, measure the patient's daily fluid intake and output. C, the document the patient's medication. And the D, to assess the patient's mobility. So B is correct. What is the most important nursing intervention for a patient with a wound dehiscence? Option A, encouraging the patient to cough and laugh. Option B, applying a sterile saline soaked dressing to the wound. Option C, using a non-sterile dressing. And the D is giving the patient a high fat diet. So the B is the correct. 23. What is the primary purpose of a patient care plan? Option A, to manage the hospital's resources. Option B, to provide individualized care based on a patient's needs and goals. Option C, to document the patient's medical history. And the D, to provide a list of medications to the patient. So the B is correct. Which of the following is a key sign of a newborn with jaundice? A, bluish skin color. B, yellowish skin color. C, pale skin. And the D, a rash. So the B is correct. What is the primary nursing intervention for a patient experiencing severe pain after surgery? A, telling the patient to ignore the pain. B, providing scheduled pain medication as prescribed. C, giving the patient a glass of water. And the D, encouraging the patient to be in a noisy environment. So the B is. Which of the following is a common side effect of antipsychotic medications? Option A, increased appetite and weight gain. Option B, decreased appetite. Option C, sudden weight loss. Option D, a rash on the skin. So A is correct. What is the most important nursing intervention for a patient who is a flight risk? Option A, placing the patient in a quiet room. Placing the patient in a room with a window. C, providing a safe environment and monitoring the patient closely. Option D, encouraging the patient to take a walk. So the C is correct answer. In obstetric nursing, what is the purpose of fetal monitoring? To measure the mother's blood pressure, to measure the baby's weight, to assess the fetal heart rate and uterine contraction, to determine the baby's gender. So the C is correct. What is the therapeutic relationship in psychiatric nursing? A social relationship between the nurse and the patient, a relationship based on a nurse's personal feelings, a professional and purposeful relationship focused on the patient's well-being. Option D, a relationship where the nurse is a friend to the patient. So the C is correct. What is the most important nursing intervention for a patient with postpartum hemorrhage? Option A, giving the patient a high fat diet. Option B, monitoring the patient's blood loss and massaging the fundus. Option C, encouraging the patient to walk around. Option D, giving the patient a cold bath. So the B is correct. What is the primary role of a nurse during the first stage of labor? to push the baby out, to monitor the mother's and fetus's vital signs and provide comfort measures, to administer a C-section, to provide a new diet plan. So the B is correct. What is the main purpose of breastfeeding for a newborn? To help the baby sleep, to provide nutrients and passive immunity to the baby, to prevent the baby from getting a cold, to help the baby with mobility. So the B is correct. Which of the following is a key sign of a patient with deep vein thrombosis? A sudden increase in body temperature, swelling, redness and pain in the calf or thigh, a severe headache, a rash on the skin. So B is correct. What is the primary role of a community health nurse in a vaccination clinic? Option A, to diagnose diseases. Option B, to provide medical treatment. Option C, to administer vaccines and provide health education. Option D, to perform surgery. So the C is correct. What is the main purpose of a health promotion program in community health nursing? To treat a disease, to manage a chronic illness, to improve the health of individuals and communities through education and empowerment, to provide a list of medications to the community. So C is the correct. What is the chain of infection? A series of steps that a microorganisms must follow to cause an infection, a type of medical equipment, a list of diseases, a method of sterilizing equipment. So A is correct. What is the purpose of medical asepsis in nursing? To create a sterile environment, to reduce the number of microorganisms and prevent their spread, to clean the hands to prevent the spread of microorganisms, and to store sterile equipment. So the B is correct. What is the primary purpose of a neurological assessment? To assess the patient's blood pressure, to assess the patient's level of consciousness and neurological functions, to assess the patient's pain level, and D, to assess the patient's risk for falls. So the B, to assess the patient's level of consciousness and neurological function, is correct. 39. Which of the following is a key sign of a patient with hypoglycemia? Option A, shivering, sweating and confusion. Option B, high blood pressure. Option C, unexplained weight gain. Option D, a sudden decrease in body temperature. So A is correct. 40. What is the therapeutic communication in nursing? Option A, a form of conversation with the patient. Option B, a method of documenting patient vital signs. Option C, a goal-oriented form of communication used to build a trusting relationship with the patient. Option D, a form of non-verbal communication. So C is correct. What is the primary purpose of post-operative care? Option A, to prepare a patient for surgery. Option B, to provide care and monitor for of our patient after surgery to prevent complications. Option C, to administer a high dose sedative. Option D, to provide a new diet plan to the patient. So B is correct. Which of the following is a key symptom of a patient with tuberculosis? A mild headache, a chronic cough, fever and weight loss, a sudden increase in blood pressure, a rash on the skin. So the B is correct. What is the main purpose of a psychiatric assessment? To diagnose a patient with mental illness, to assess a patient's mental and emotional state and create a care plan, to prescribe medications, to provide a list of medications to the patient. So the B is correct. Which of the following is a common symptom of dementia? Option A, a sudden onset of a headache. Option B, memory loss and difficulty with problem solving. Option C, unexplained weight loss. And the D, a sudden drop in body temperature. So the B is correct. In obstetric nursing, what is a Braxton Hicks contraction referred to as? True labor contraction, false labor contraction, contraction that occur after the baby is born, contraction that occur only during the first trimester. So the B is correct. What is the primary role of a nurse in a psychiatric setting when a patient is experiencing a panic attack? To leave the patient alone, to provide a calm and quiet environment using therapeutic communication, to tell the patient to calm down, to administer a high dose sedative. So the B is correct. What is the most important nursing intervention for a patient? Urinary retention. Option A, administering a high dose sedative. Option B, placing the patient in a supine position. Option C, encouraging the patient to drink more water. Option D, inserting a urinary catheter as ordered. So the D is answer right. What is the primary purpose of a patient care plan? So, option A, to manage the hospital's resources. Option B, to provide individualized care based on a patient's needs and goals. Option C, to document the patient's medical history. And option D, to provide a list of medications to the patient. So, the B is right answer. 49. Which of the following is a key sign of a newborn with respiratory distress? Option A, a slow heart rate. Option B, rapid labored breathing and nasal flooding. Option C, a pink skin color. Option D, a sudden increase in body temperature. So the B is correct answer. And the last one is 50. What is the most important nursing intervention for a patient experiencing anaphylaxis? A, administering sedative. B, maintaining an open airway and administering epinephrine as ordered. C, giving the patient a cold bath. D, encouraging the patient to walk around.